Trump seems all in on going back to normal, with normal being the United States minus a few million people. But it's not just him. Over the past 48 hours or so, Fox News has taken a hard turn to supporting the president's position on this. Take a look at this.
We've quarantined much of our population because informed people thought we had no choice. It was a decision, whatever else it was, that was made in good faith. But there's another side to that decision. The shutdown has come at a terrible cost for an awful lot of people. Millions of Americans have lost their jobs. An economic crash clearly looms in the near distance, and that's not a small thing. It could change this country forever, more even than the virus itself. Americans have never been more grateful for their doctors and their nurses and their scientists, and for very good reason. These are the people working and exposing themselves to great risk to save us from the scourge. But the truth is, you can't just let epidemiologists run a country of 320 million people, just as you would never turn America over to a team of economists. Not because they're bad people, they're mostly good people, but they are specialists, and their range of vision is too narrow. As in everything, you need balance.
I mean, there's a lot in there. They're specialists, the epidemiologists. Their range of vision is too narrow. Look at them. They're only focused on millions of Americans not dying. We need balance. Yes, we don't want everyone to die, but that stock market, though. I mean, honestly, and like he says it in this measured tone, and he says healthcare professionals are great. And so he seems like he's being reasonable, but what he's calling for is what every responsible healthcare professional, someone in a position of power in the WHO, the CDC, is saying will produce a worst case scenario where millions of people die. Disproportionately older, millions of people will die. And that's what the very reasonable Tucker Carlson, that people love to twist themselves into pretzels to give credit to, is calling for.
Yeah, well, again, he brought up how we can't have a singular approach to this with the professionals in this particular field, but you wouldn't. I think he brought up. Didn't he bring up? You want to bring up economists? You don't
Yeah, you
load
wouldn't
a whole
have
place
a
full
team of economists just running things for the same reason.
Seems like we kind of not even a team of economists. It's a team of greedy capitalists looking to run things. That's what we've got. This comes from the same folks who supported a push for a president that said we need a businessman president in a country where other things happen besides business. And let's point it out. Every time we've seen anything else happen in this during this guy's term that don't have, first of all, that do have to do with business he sucks at, and that doesn't have to do with business he just denies its existence, especially if it's something that has to do with science or anything that he can't understand, he can't wrap his head around. What he can wrap his head around is making money for himself, hoarding, things like that. So that's the president we put in place, and we've seen the results. It's exactly what we expected.
Yeah, and I mean, I could go on for a long time about Tucker Carlson. I don't want to. So let's move on. Ed Henry said the best estimate of the mortality rate here in the United States is 0.7 or 0.8%, as in less than 1%. That is not what I've seen. Now, every life matters, and you don't want to minimize any of them, but when the mortality rate is that low, what is the balance? By the way, what I love is a sentence that starts every life matters and then has a but in it, which implies that maybe not all lives matter as much necessarily.
Yeah,
but what is the balance? And here's the thing. It wouldn't morally be different, but in terms of optics, it would be a little bit different if, like, an elderly homeless person was like, you know what, we need some sort of balance. Someone who is actually, like, maximally at risk in this situation. But rich people who are in clean rooms, effectively walled off from all of the actual threat, saying we need balance, that's not balance. First of all, going back to the way things were, where you guys dominated literally everything, all policy was crafted to satisfy what you wanted, going back to that, it would not be balance. But us sacrificing ourselves at ever-increasing numbers so that you, while being fully protected, can feel a little bit more comfortable about how your stock portfolio is developing, that is not balance, not in a moral sense, not in any sense that I can understand.
Yeah, it's again, it's the sole focus that they have. It has nothing to do with saving people or anything like that. Now, people that have been around him also are worried about this, bringing us back, hurrying up and doing this. There's been specific and constant, I guess, pleas for this to go differently. So also, I just saw this morning, so his ex-Trump official, he used to be with the Homeland Security, Tom Bossert. So he was the advisor to Trump during this whole thing. But he's not there anymore, so he can say things like this. He tweeted this. It's Thomas Bossert, formerly with Trump's Homeland Security, not Obama's, not W's. The case fatality rate is the percentage of people infected that die. People saying it's only 1% must acknowledge the total number goes up in real lost lives. This is like he's saying this, and it's supposed to be like a groundbreaking, eye-opening thing. This is common sense. Now, he continues, if we prematurely return to open society without controls, more infected people means more total deaths. 1% of 66 million equals 660,000. So you can talk about all the numbers of it's only 1%, but we haven't even hit the number of infected rate. And if we go back out and start spreading it further, then the infected rate's going to go up. And guess what else will go up? The death rate. You idiots. I don't know. It's weird that I have to say that, or that even Bossert had to say that. It's common sense. I don't get how this is missed.
Yeah, and look, right now, you can guarantee that there are people who are dying in every state in the country, not from coronavirus, because they were never tested, because the tests aren't available or they weren't provided. Lots of people would love to be tested, but can't. But they're dying of things that look sort of like the flu, but they're not the flu. And we won't know anytime soon how many of those are. Maybe at some point, a bunch of academics will do some sort of study. They'll track down all of this and they'll try to get an idea of how many people actually died. But as of right now, we can assume, and look, and they're all saying that the numbers that are being reported, both the number of total cases and of fatalities so far, is probably 5 to 10 times lower than the actual number, because we just don't know. And before we even know, they're going to go back to normal. And by the way, this is from the guy who loves saying, until we figure out what's going on, we need a complete and total shutdown of anything that doesn't infringe on my life in the slightest. That's effectively what he's saying. So we can't shut down to figure out how many people actually have this thing right now. We're just going to go right back to normal. So I would say that the numbers would spike following that, but they're mid-spike right now. Like, we need to let it level off. And don't listen to me. Listen to the doctors. Listen to people who actually know.
The only reason you're saying what you're saying is because you are listening to people who know what they're talking about. Like, it's okay to listen to someone who knows what they're talking about, actually has the best interest of their specific field and expertise in mind. This, again, back to Tucker Carlson, this being the people who are experts in the field, telling us about their expertise. That's kind of the point. Two other things. So Trump's pushing a new comparison as a reason to go back and just spread it across the country even further. He brought up car accident deaths, and how high that is, how it's way higher than what flu deaths or whatever he said. I'm not even sure what those numbers are because he didn't give any. But so he
car
said,
deaths,
should we
I think, are around 50,000 a year in the U.S., give or take 10,000.
So, and he said, so we shouldn't ban automobiles because drunk drivers kill people, or that, whatever, people that are under the influence of whatever kill people in America. So, you know what we do have in place? There's these rules, there's these laws. They're called DWI. When you get pulled over, you get arrested, you get fined. And then it goes on your record. And the more you do it, you lose your privilege to drive. There's things put in place to deter these things. We used to have a huge drunk driving problem, and it's lessened because of the activism and the laws put in place to prevent it. We do things to prevent the number of deaths from going up, and it's worked. Crazy how that is, what is this other example? The flu. Oh, there's this weird, crazy thing that we call the flu shot. It's a vaccine, and people who a lot of times rail against it or don't do it, or anti-vaxxers, there's a big battle going on in this country, Donald Trump. And people are battling people who don't want to do things like vaccines because it'll help spread it, and more people be infected, more people have a potential to get sick and die. Crazy how that works. We don't have any of those put in place for this. We have to set it up first. It has to be worked out. In the meantime, chill out.